Yeah, just to add to that, Minister, that it is disappointing we don't have somebody from one of the Ministers for Health here. However, the issue for Drimnagh is the total neglect of the area, and this is adding fuel to the fire, moving nurses out of the Mother Macaulay Centre on Curlew Road over to Armagh Road. Now, one could argue, well, they're both Dublin 12, so what's your problem? They're actually very separate geographical areas, and there is no bus link joining the two areas directly, or indeed joining the two centres. And it's important to remember that a lot of the people who use the centre are elderly. There's a dementia clinic there. It is mainly elderly people. There's also a mother and baby clinic there. So transport is an issue. And I understand they've been told that there's going to be some transport link between them, but it's very vague and there's nothing clear. But I think the point here really is that it is another kick in the teeth to Drimnagh, another diminishing of services, another, sort of, we're short of staff, so we have to pick on Drimnagh again. And it is not acceptable. Indeed, the shortages of staff are not acceptable. And if they're to move all those clients from Drimnagh to Crumlin, then we are probably looking at an overcrowded, understaffed and very badly delivered service if they're all to pile into the one area. So it requires explanation and it requires urgently being dealt with.
And I'm responding on behalf of Minister Donnelly and accept the comments made by the Deputies Colin Smith and O'Snoddick in relation to this important issue. We all agree that public health nurses play an extremely valuable role within the community healthcare system, providing an extensive range of services that is vital to local communities across the country, including Drimnagh, and they have access to public health nurses when they need them. However, consistent with recruitment challenges across the health sector nationally, and noting the previous statements item here in the Dáil this afternoon, the public health nursing service in Dublin South West is currently dealing with significant staff shortages, and these shortages are mainly due to reductions in the availability of staff due to retirement, internal movement and leave. Despite ongoing recruitment campaigns and attendances at both national and international recruitment fairs, the recruitment of public health nurses continues to prove particularly challenging for the Dublin South West area. The HSE has assured Minister Donnelly that it will continue to make every effort to provide the required nursing services to the population despite these recruitment difficulties. To ensure that any impact on service provision is kept to a minimum, the Public Health Nursing Service in Dublin South West has taken the decision to pool resources as a short-term mitigation measure. Public health nursing services will be consolidated in Armagh Road, with a satellite clinic to be provided in Curlew Road. It is hoped that the provision of satellite clinic will ensure minimal impact on service users. It is also important to note the HSE has advised that this change will see no impact on those receiving domiciliary nursing services. The HSE expect implementation of this process to begin the week of April the 3rd, 2023, with a communication letter to be issued to service users and relevant stakeholders in advance of this date. Very importantly, the HSE advised that this measure will be subject to daily monitoring to ensure continuity of care and to manage risk. The HSE has also reiterated that as and when staffing levels increase, nursing staff will return to Curlew Road. Minister Donnelly has also been informed that occupational therapy services, dietetics and addiction services will continue to be provided from Curlew Road Health Centre. In addition, in response to the broader challenges of recruitment and retention of public health nurses, the HSE established a Community Nursing National Oversight Group last year, and the group is tasked with developing proposals and recommendations which will aim to address the issues in recruitment and retention of public health nurses and community registered general nurses. Of course, the Department recognises the stress and the frustration caused by the shortages in public health nursing, and the Department and HSE would encourage any service users with concerns to contact their local public health nursing service directly. And again, just to note the points raised by Deputy Smith and Deputy O'Snoddick in relation to transport links, because that's a critical issue particularly for elderly and for anyone accessing services or clinic appointments. So I'm noting that point as well. Thank you.
Yeah, just to add to that, you see, the last session during the afternoon there was a session here on safe staffing levels in our health service, and safe staffing levels aren't just to do with the staff; they're mainly to do with the patients. And we're putting the patients in Drimnagh The elderly, the people needing the mother and baby care services, people with dementia, we're putting their safety at risk by doing this. Now, I can see why you're saying they're left with no choice because of staff shortages, but these things are connected, and the staff shortages are connected to the lack of housing. We're dealing with that all week, and we're going to be dealing with it again next week. The lack of housing for staff in this state is an utter disgrace, and it is putting the safety of patients at risk. So there's something needs to be done, something urgent, and I doubt that the people of Drimnagh will just accept that everything is going to close for Drimnagh on the 3rd of April and everyone's got to traipse over to Crumlin and traipse back again. This is not acceptable, and if that's the only answer we're getting here this evening, then I think we have to go back to the drawing board with the rest of the community.
Again, to note the concerns of the deputies, that it is a short-term measure while these recruitment challenges exist, and there is a commitment there to develop a new primary care centre at Curlew Road within CHO7. But by pooling public health nursing resources, the service can provide better continuity of care while ensuring that those with the greatest clinical need continue to be seen in the community. The HSE have assured the Department that this mitigation measure will be under daily review and will help to ensure delivery of a safer service. The population of Drimnagh will continue to be served with Curlew Road acting as a satellite clinic, and once staffing levels increase, nursing staff will return to Curlew Road Health Centre. While every effort is being made to address the recruitment challenges in the short term, including ongoing campaigns, there are longer term recruitment challenges facing a range of sectors, including the health sector. It is expected that the recently established Community Nursing National Oversight Group will propose recommendations later this year that aim to address some of the longer term issues regarding recruitment and retention of public health nurses and community registered general nurses. Minister Donnelly wishes to reassure all deputies that the Department of Health and the HSE will continue to work together to review and monitor staffing and service levels, and will work to utilise all practical options to fill vacancies, whether they exist in Dublin South or Dublin South West or elsewhere. And again, I note the concerns that the deputies have raised, particularly in relation to transport and the inconvenience that this is causing to clients and service users within the health centre, and particularly in relation to the issue raised by Deputy Smith in relation to transport. But this is a temporary measure while these recruitment challenges exist. Thank you.